Before we meet our care managers, we are going to meet a very important team. As you can see on the screen, we've got the Aging Life Care Mid-Atlantic Chapter Conference is coming up in a few weeks on November 3rd. And as you can see on the screen, there are some premier sponsors that have supported this event who we've gotten to know over the last few months. Inspīr Embassy Row, Beverly Assisted Living, Kensington, Advanced Nursing and Home Support, Graceful Transitions, the Fitzgerald. But today we're going to be spotlighting Kensington Senior Living. And so let me welcome our team from Kensington Senior Living to the stage. And we've got Desi and Mary today. And I know you guys have an exciting announcement, but before we get to that, let's get to know the two of you a little bit better. Desi, Mary, tell us a little bit about yourselves and Kensington Senior Living.
Thanks so much. And we're excited. We're going to be also at the conference on the 3rd and 4th. So we're excited to see everybody there. And I'm Mary. I've been in the senior living field for over 33 years. Happy to be with Kensington Senior Living at Kensington Park for the last 10 and a half years. And I just want to say, the care management piece to me as a caregiver and doing what I do is just such an important relationship. So I wanted to just thank all of you first to let us participate in this. And, as part of Kensington Senior Living, we're opening up an 8th community that I'll let Desi share all about that with you. But as a company, just really committed and dedicated to making sure we're partnering with professionals like you. So thank you for having us. And my co-partner over here, Desi, I'd like to have you get to meet her.
Yeah, Desi, let's get to know you a little bit better.
Sure. Well, thanks again for having us on your platform. My name is Desi. It's really a Desi, but I go by Desi for short. I have been in this industry for a little over 20 years. Started off as a nursing home administrator and now transitioned to Kensington Senior Living to open up our brand new community, Kensington, Bethesda. Over the years, I've partnered with a lot of the care managers, and I want to thank you for your support throughout this journey.
Great. Now, you all gave me a slide deck that I'm going to pull up here, and this is an exciting new chapter in the life of Kensington Senior Living. It's a brand new community in Bethesda.
So we're happy to have Desi start with us as the executive director at Kensington Bethesda. And it's scheduled to open in June of 2025. If you're not aware, Kensington Senior Living, really our philosophy is taking care of someone like your family as we do our own. That has also extended to not only the residents, but the families and to the team member as a whole. Really the basis for how we execute on service. So I'll let Desi tell you about her new opening.
All right, this is really exciting. As you can see on the slide, we are slated to open summer of 2025. This is going to be all assisted living. It's going to be 116 apartments, 5 floors, floors 1 and 2. It's going to be your traditional assisted living. 3rd floor and the 4th floor are 2 levels of memory care. And then we have the 5th floor, which is our assisted living with concierge services.
You can
Next slide, please. So all of this information, we are having our information center open up mid-November. We're actually taking this call out of the information center, but it will be open to the public mid-November. In this center, we would be able to provide you a sneak peek of the community as well as lectures for both professionals and lead prospective residents.
And then the community actually itself is going to be right behind the sales office, behind the Kenwood building, if you're familiar with the area, right on West Bard and River Road there at that corner. It's in the process of being completed now, and we should probably end up having it turned over to us by April.
Great.
Thank you, Steve. You can change the slides, and there Desi will introduce our team that we've started with so far. Some of you may know them.
So you already know Mary Mel. So Mary will be managing both Bethesda and Kensington Park. I am going to be leading the community as the executive director. And Buckley, who has been with Kensington Senior Living for a couple of years, will be transitioning to Bethesda as well. We have Brooke Bollinger, who a couple of you must have worked with. Brooke is also transitioning from the Kensington Park to Kensington Bethesda.
Thank you, Steve. You can change slides. And then, we do have 3 levels of memory care. And some of you know our Kensington Club, that's actually within the assisted living. It is a small group led by a coordinator who takes those residents that can still be in assisted living, but need a little bit more redirection. And they form groups and friendships, and they take them through their day. They have breakfast on their own in the main dining room, but then come together, and then meals are also separate, like back in with the main community. But becomes a group of friendship and a beautiful, beautiful start to the journey in memory care. The second and third levels are actually connections, is more moderate. Focus is really on programming and activities and engaging those residents. And then the third level of memory care is our Haven, which really is all the love and care that someone needs in the end stages of dementia. Thank you, Steve.
Great.
The other component on this is really just, we're in the process for Bethesda of really providing providers and working with some clinical providers, but it's bridging that gap and having enough of the support team to partner not only with the families, but with the clinical support team as well, to really provide the care. It's not just here's our recommendations, but it's a team effort. And that's really the focus for Kensington Senior Living. And that just gives you a description of what the memory care levels are. Couples care, I know many of you have worked through this with us, but we really try and customize this. Each couple has different needs at different point in times. We've been fortunate throughout Kensington Senior Living to, have couples stay together, have them, one in assisted living, one in memory care, one in independent living, whatever works. And I think, that is a key part to kind of making sure the family stays together. Lastly, we have life enrichment, which many of you know. You've utilized our music therapy and brain wellness programs, which are really unique to us. It's a big focus on clinical music therapy, and we have also attended a music symposium where the drive is really to how do you get Medicare to pay for music therapy, like regular physical therapy, occupational or speech therapy, which is really what is needed in the long term. So we're proud of those programs. Many families participate in that, and it really is benefiting the resident.
All right, so again, we are super excited to present this community to you. We're looking forward to having you come over to our sales center and take a sneak peek of the community.
All
Thank
right.
you, Steve.
This is
Thanks,
great.
everybody.
And it's so funny that for those that do have the 2024 source book, this picture was taken when it was just not even a hole in the ground. It was before there was a hole in the ground. So it's exciting to see that the opening is right around the corner. This is really cool. So hang on a bit, Mary and Desi, because let's meet our care managers that we're spotlighting this month. If I could have Karen and Heidi and Robin on the stage. All right. So really charged up to have another roundtable discussion. And folks, just so you know, you got some of the leading experts here that have seen everything related to aging and longevity. And so if you've got questions and things like that, be thinking about it. But I think that through our discussion, we may say something that prompts you to sort of ask a question or just get some feedback. But let's see. Karen, how about if I start with you? Tell us a little bit about yourself and how you got into this business.
Well, I've been doing this since 2001 after somewhat retiring from Georgetown and having a background in long-term care and also acute care. I found that I really saw an enormous need for individuals, especially with complex care and geriatrics, needing more care support. And really, care management was still sort of a little bit in its infancy at that point. And we just started to slowly develop more and more clients over time. I have a background of study in terms of being a licensed assisted living administrator, also an RN, and training as a nurse practitioner. So I found that this was the best way to kind of show my skills and abilities in impact care.
I love it. All right. And Robin, tell me a little bit about your background.
All right. I've been like Mary Mel. She's reminding me, I've been doing this as long as she has, 33 years. And I think we started somewhere near the same community. I wasn't a care manager then, but I've done everything from activities to marketing. What led me to go into care management was working at a day center. I saw the impact that the social workers there had on the lives, the real day-to-day impact that they had on the lives of our participants at our day center. So I went back to school and knew which agency I wanted to work for and hit the ground running. And I've been at Aging Network Services for 15 years.
Yeah, and then Karen, your organization is I always botch the name
Eldementals. Eldementals. It's sort of I actually made it up. We brainstormed with the group, and it's essentials, fundamentals, aging, elder, all together.
I love it. And you're the founder of that. Robin, I mean, your Aging Network Services are truly it's an icon. And Barbara and Grace, the founders, I mean, when I entered this business in 35 years, they were one of a very small handful of what we called geriatric care managers back then.
Yep. And we're still here 35 years later and still going strong. So,
and then Heidi, tell us a little bit about your background, and you're with ElderTree.
I'm with ElderTree. So just like Karen and Robin, it is a journey. Just like care management is a journey, coming to working as an aging life care manager for me was a journey. I've been in all different iterations in healthcare, starting back 30 years ago. I've done everything from running a traumatic brain injury program to working in communities to working in elder law. And so each time I thought to myself, I want to be a part of this journey earlier. So ElderTree is 20 years. We celebrated a 20-year anniversary last month. I've been with ElderTree 8 years, and that's how I came to wanting to be an aging life care manager. Was let me gather all this information that I have. Did a lot in the hospitals, high acuity individuals, but I want to be part of the journey, walking the journey with families and individuals.
I love it. Well, man, what a varied background. So I know that this is going to be a great discussion that we have today. So Karen, I'll go back to you. I like kicking off these discussions with what is an aging life care manager, because I think there's going to be a few people in our audience today that are tuning in because they don't even know what the heck this is.
And it is a common question. Care managers, we wear many hats, we're many things to many people, but basically just to kind of give a simple definition or a somewhat complicated definition, but care management is basically a team-based, patient-centered approach, basically to care, designed to assist patients, family members, their support systems, and really more effectively managing complex care situations, as well as supporting sort of holistic health, wellness, and more effectively supporting all these aspects in alignment with expressed wishes and preferences of the individual. So really, we're a discipline intended to improve patient care and outcomes by, one, enhancing coordination of care, eliminating duplication and error, supporting effective, and I cannot stress enough, transparent communication and collaborative team practice. And then again, helping patients and caregivers to more effectively manage healthcare conditions, challenges, aspects of living through really proactive planning and collaborative management. So we really guide families in navigating many complexities of sort of the continuum of care and health, giving guidance, support, resources, advocacy, consultation, evaluation across many areas to support, again, anything from aging in place, relocation, cognitive evaluation, safety, resistance to care, and so much more.
I love it.
Excellent.
Robin and Heidi, you want to jump in with any additional ways that we might frame your profession?
I thought that was excellent. I thought she did a great job. I think that the focus on planning is really important, and communication. Once a family meets with us, one of us, and gets a sense that there can be a plan, that this doesn't have to be chaos, that this patchwork that we're trying to put together can have a calmer feel. That is one of the benefits of having a care manager is, I think Karen put it earlier, with putting some calm to the chaos, and, you know, a plan A and a plan B and a plan C really can help settle people down and realize once that happens, then you have more time to be with your family member who you're helping support, rather than doing all the time. And being is a gift, just being, you know, and having a partner with you through this allows you to be a little more, which after 15 years, I feel like that's one of the greatest benefits of hiring someone like us. So
I love it. And Heidi, anything to add? And then we're going to kind of jump into our little round table here.
Now, I have a client that once said, "You are like having someone who knows what I need, when I need it, and helping me to identify it." Just a simple sentence, right? And, you know, as care managers, we wear so many hats because people come to us in so many situations. And that could be mental health. That can be dementia. That can be that something's not quite right. And we are helping you to kind of unpack what that means.
That's
And so we're unpacking that. I like to use, hedging back to the music therapy, we're like a conductor. We know all the music. We know all the players. We know all the nuances, and we gracefully assist you in cueing those in, giving you options, and making decisions along the way.
And since I've still got Desi and Mary on the screen here, when you guys have a lot of different families and individuals that are living in the Kensington senior communities, do you see a difference between those that are, you know, using an aging life care manager for some kind of support? Oh, whoops.
Oh, we got it. Can you hear me
Yeah,
now?
I can hear you. Yeah.
Oops.
Resource of bridging that gap, and also, you know, it's a separate party from, you know, what we do day in, day out to take care of that resident. You know, everybody's taking care of that resident, but it's, you know, that kind of that third party that's there in their corner. And I think that's reassuring to families as well, as we continue through that relationship to partner with them. So thank you for asking.
I love it. I love it. Okay, this is awesome. Okay, because
Desi and I are gonna just pop out and
okay. Thanks so much for your support again.
Behind the scenes. Thank you. Nice to see everybody.
Thanks for having us.
All right. Now, just like all care management, you know, we had a little huddle in advance, and we were going to talk about, everybody had a few different talking points, but hey guys, this is like amazing. We've got Judah who says, "This all sounds great, but it's way too general for me as a caregiver to my husband now. What do you do specifically? Perhaps you could give an example." And how about we do that? For, you know, Judah, who's a caregiver for her husband, maybe a few examples of how in your all practices you've helped people like Judah.
Judah, caregiver fatigue is real. caring for it. There's a book, an older book called The 36-Hour Day. And it is because you're caring for that individual. You're waiting for the next thing to come that's unexpected. You're trying to create those parameters. As care managers, we walk that journey with you. We help you identify resources that can help you. There's this phrase that says, when you're on an airplane, put your mask on before helping someone else. And so it's not only helping you identify things to help care for that person that you're a caregiver for, but also for you. So we walk that journey with you.
I think to add to that, just, caregivers in general, sometimes you develop such resilience fatigue, that sense of trying to create calm and saying it's all okay and pushing things down to the point that sometimes you don't even know where to start. So as care managers, we can help by listening. The healthcare continuum is fast. Everything's fast. Everybody's seeing you for a consult quickly. Care managers slow it down. We listen. We actively listen. And then we add. And we look at the whole person, not just a subset. We look at everything and help you to prioritize and organize some of those thoughts and operationalize the areas that maybe you haven't realized need to be operationalized. So we come up with, again, a plan on your terms by listening, by looking at all the past documents, diagnostics, consults, everything, so that you feel comfort. And again, as Rob and I kind of were saying earlier, creating calm amid the chaos through operationalizing and next steps that make sense for you with your input.
I think jumping on what Karen's saying, I love the word add because, and what Heidi was saying, we come in and we look, and by listening, we can anticipate for you. So that when Heidi says, you're waiting for the next shoe to drop or the next thing to come along, well, if we can help you anticipate, because we've been doing this a long time, we know what might come next, we'll have ideas that you may not even think about, whether it's a music therapist, I had an art therapist come in recently for someone who spent their entire life using a pencil because he was a journalist. But if he can do art and come back to using that pencil because he can't do words anymore. So that's something very specific. Adding is resources that you may not know about.
Mm-hmm.
And we don't just add for the client, for the person who's got the disease, we add for the family. I had a guy tell me this morning, I was sitting on the porch and he was coming from Portland. His dad, they went through so much pain to get their dad moved here from Florida. And he said, I don't know how you did it. I don't know where you found these people. They're taking such good care of him. The last time I was here, I had 10 days. I was exhausted. I thought I was going to end up in the hospital before my dad. And now he can sit on the porch and be with his dad. Of course, that costs money. So we want to find resources that fit everybody's budget. But those are specifics, just giving.
And here's something else that Judah, the Aging Life Care Association has put together these 8 knowledge areas of legal, crisis intervention, health and disability, financial, housing, family, identifying resources, and advocacy. These are some of the areas that I'm sure our care managers will say that your practices intersect in those various areas.
Yeah.
And we talk about all those things, right? So when we meet you, we're going to say, are your legal documents in place? And if you say no, they're about 25 years old, we might say, well, we can provide you with a resource and connect you with an elder law attorney. Sometimes you may be each other's. Maybe as a couple, you're each other's agent. And now something has changed. When you wrote those 25 years ago, you never imagined that your loved one might have dementia. And now you need to think about redoing them. And so, and assets, looking at your assets and being a good steward of your finances. What can we get put into place, resources available through the community, and then layering with private pay. So I loved your example, Robin, of looking down the road. I always say that, like, we're talking to our clients and we're thinking the next thing down the road, so that we know when to cue it in. And we might say to you, you know, right now we can do this, but down the road we might consider. And so you know that we're always thinking ahead.
Right.
I think just to kind of add to that, you know, as individuals who are knowledgeable and have a lot of experience and expertise in all these different areas and complex conditions, we can really speak to, unlike really anyone else you're going to intersect with, you know, across the continuum of care, we can truly speak to what things look like now and what we can anticipate they're going to look like in the future. So, and oftentimes for caregivers, by being able to listen and really understand what their goals are, we can help you to understand if the goals are realistic, and what we can do still if they aren't, how we can come to an agreement and an understanding of what could be realistic based on express wishes, values, cultural components. And then being able to create that plan creates some calming for individuals. When
It
you
really
know
does.
you anticipate, yeah, you're going to have a bump in the road. Of course you are. But I was just reminding someone yesterday, yes, we anticipated this. We know what we're going to do next. And the individual's wife looked at me and said, yes, thank you.
I love
So
it.
Karen,
Now,
that's a great example. And that goes back to my plane analogy. You know, often when you're on a plane, the pilot will say, buckle up. We're going to feel some turbulence.
turbulence.
If you didn't know that turbulence was coming, it would be really unnerving. So even though you don't like it, at least you know that turbulence is
oh,
coming.
these
The
are some
fear of
great,
unknown.
great examples. Okay. I knew this was going to happen. I even told the three of you that it was going to happen, but Glenna asks, what is the average cost for engaging the help that you all provide? And one thing that because I've done so many of these, one thing, correct me if I'm wrong, but your three practices and most practices have an initial sort of free get to know you, hear your situation. Is that correct?
Yes.
Yes.
Okay.
I
But
always tell
on
people,
on the topic of cost, you know, what can people expect if they're hiring an aging life care manager?
Well, I mean, I'm happy to speak to that. You know, one thing I want to reinforce is always look on the Aging Life Care Association. There's a listing of us, and look for the best fit and interview several because you want to find the best fit. But that being said, you know, in the DC metro area, you know, care management can range anywhere from $150 to I've seen like $285 in this area for per hour. And generally individuals bill in 10-minute increments. Most of us will always talk about care management and do a meet and greet once or twice, you know, free of charge. I know in terms of our practice, we also consider financial hardship. So if there is a family that really cannot afford care management, we will work on something. And our clients that do have a Medicaid conversion, we promise to continue with care management at that point, free of charge until the end of their life. So I think also just looking at long-term care insurance, most long-term care insurance providers have some sort of coverage for and funds for care management. So again, looking at finding the best fit for you, both in terms of the individual and in terms of the cost, I think is important.
and I would just reiterate that it doesn't cost anything to talk to someone initially. And I'm sure our databases are filled with people who talk to us, and we're able to, if we're not the right fit, refer them out to places that are the right fit, an agency or a respite something or whatever, that a resource that they may not have thought of. So it doesn't cost anything to talk to one of us.
And you know, I do these roundtables with aging life care managers and daily money managers and elder law attorneys, and the question of cost always comes up. And one of the things that's impressed me on all the professions in this world of aging and longevity is that folks will get creative and figure out how we can deploy resources based on your budget or your comfort in sort of paying for something. And so it might not be, 20 hours a month. It's
Oh,
like, we're going to figure out how we can solve this problem with 1 hour and point you in the
10
right
minutes.
direction,
Right.
We do individual consultations, single consultations.
Right.
Some people come back to us every couple of months. We can provide plan A, B, and C in our first consultation. The family then can go implement that and just come back to us as needed. At the same time, I have clients I've been seeing for many years because family lives overseas or in California, and I'm the boots on the ground. That goes to
Yeah.
what Karen's definition was. We can be as much or as little as you need.
Yeah.
And I
Right.
think, whoops, and I think the important component is that really our primary mission is to maximize funds and minimize costs for our clients.
Right.
So
Yeah.
at the core, I think you'll find that anyone that you call as an aging life care professional is going to do their very best to help in any way we can, irrespective of whether you have an ability to pay. So please don't hesitate to reach out. If you're struggling out there, contact someone.
Yeah.
Now, I love having a little bit of case study with these discussions. And Robin, I don't want to put you on the spot, but before we turned on the camera and I brought up crisis management, you sort of said, "Oh, I had a phone call this morning." If without revealing obviously any important client information, tell us, maybe we could use that or another example of a day in the life of aging life care manager, which is already started for you and probably for Heidi and Karen as well.
Well, I will let them chime in too, because I'm sure they have examples. Yeah, so obviously we like to help people from the beginning when they say something's just not quite right, and we go through that journey. But we will also jump in, especially with people that we've already done consultations with in the past, in a crisis situation. Crises happen. This morning, I got a call from a family member that I'd worked with before, and she had two parents who were in drastic situations. One had already passed away, and the other was in the hospital. And she needed help with move management, getting her family. She was not present in the city at the time. She needed someone on the ground at the community to help manage the move of her parents' stuff out of the assisted living. She needed someone in the hospital with her father to be at bedside with him because he was extremely confused until she could get back here. So again, we could jump in. We know these resources. We know the client. Sometimes we don't know the client in an emergency, but in this situation, I was able to jump back in and get those resources put in place so she wasn't worried and giving herself panic on the flight back. So that was just an example. That was
well. I want to dive into a couple of things that you brought up there, and I hope that this is helpful to Jutta and to others. There's a few things that you brought up. Is number one, this family needed people in more than one person to support the challenges from assisted living to the nursing, to the hospital. But the other thing that I really want to point out, and I hope we can riff on this a little bit, is that oftentimes when any of us are in the hospital, you just basically listen to anybody with a white coat and you just do what they say, and then after you're discharged, everybody is sort of Monday morning quarterbacking you. It's sort of like, you did what? Why'd you do that? Well, they told me to. And I've often found that having a care manager to advocate when we're in this situation is amazing for families. Could we use that as a thread to kind of chat about?
Yeah.
Yeah.
sorry, not to, I think honestly, the biggest role that I've seen since the COVID surge to now is advocacy. And just what you're saying, Steve, there's a reason why the third leading cause of death in the US is medical error. And many people do not realize that. Care managers, we're there keeping continuity. When the hospitalist changes and comes in and says, so why are you here today in the inpatient PCU? We can help to continue that conversation, to make sure everybody's on the same page, to make sure the discharge plan is correct, to make sure that when someone calls, like I had a week ago saying, my husband's in the hospital, he's declining. No one understands why. To meet with that care team and to push those initiatives forward, to advocate for the client, to give them the right outcome, to give them the clarity of understanding, and to give them sometimes the opportunity to plan when it is a difficult situation.
And the other thing, Karen, is just because you've got a care manager doesn't mean that the script that we're going to follow the script of life. But the beauty of it is that now you've got somebody to brainstorm and talk about, because one thing that I get is a lot of people, they just feel so guilty because, they're at crossroads and they made that decision all on their own and it doesn't go according to plan. And then they're like, I made the wrong decision.
Yeah.
Whereas when you're working with a team, it's sort of like, hey, we're going to regroup and here's what we can do.
And taking those pivots. What are those pivots? A lot of times in the hospital, ageism is real. And so someone will look at an individual and look at their birth date, and we go in there and we're saying, this is not their 85, right? And so, because we don't want them to pigeonhole that. And also, like I just did a consult with a family, and the individual is falling, their loved one is falling all the time. Well, they keep getting patched up. They go to the hospital, they get patched up, but no one has ever said, why are they falling? So, we'll say, I said, well, what does a year and a half look like ago? What, before this all started, what does, he was playing golf and he was mowing the grass and, he was up fixing the roof. And, and so sometimes advocating in the medical community to say, we need to look a little further. Let's not look at this one symptom, but why are we having this symptom? And having that voice of, confusion can happen, Robin, in the hospital. Confusion can happen. And so we become that something to orient to, okay, this is my person. I'm going to orient to them. If you go in and talk, if one of your loved ones is in the hospital and you're not able to be there, we're able to be your voice and their voice, and to be able to answer questions. If you ask somebody, are they in pain? And they say, no, like, I work a lot with individuals with brain changes. And so a lot of times people will say, are you in pain? Are you okay? And if they're not processing the words, they respond back with the gesture of yes. And so their pain isn't being managed. So is their confusion actually just unmanaged pain? So looking back at those kinds of things, we work 24/7. So a lot of times, at 2 a.m, our team is going out and we are, until someone can get there. And that's what we do. But we also all work on teams. So, if there's clinicals, letting that OT on our team read the clinicals and say, hey, wait a minute, they want to discharge and I'm noticing this. I think and going back to that care plan meeting and being the voice.
I think what Heidi's saying is really important to inpatient management, because the care manager is really that knowledgeable party across all areas. And I know in terms of our practice, we're very clinically focused, because clinical impacts pretty much, all the areas. And so we do a very good clinical historical chronology when we begin with our clients, looking at also baseline cognition and all of those components so that we truly can speak to where the individual has been, look at patterns and trends, and help it to move forward. And again, as Heidi's saying, there's a lot of ageism. If you go to the hospital and you're 85 or older, they'll say, do they have dementia? No. Stop. I mean, not everyone 85 and over is cognitively impaired, or it's so having an advocate, having a knowledgeable party who understands you, understands the health, understands what the goals are for next steps, and can really work with the team to say, gosh, if we looked at this, if we looked at that, clarifying and helping clarify diagnoses, even to push things forward for proper management. That's a struggle I see. Everyone's coming out with dementia unspecified. And families have no information to plan to move forward. So care managers oftentimes provide that insight, like Heidi's saying, like Robin's saying, to give clarity for planning and to be that knowledgeable party to help guide things forward.
Oh, wow.
Well, and Steve, one area we didn't even touch on is mental health, because mental health, we deal a lot with mental health, but also I'm sure we all do, special needs. You don't have to, aging life care manager is a continuum. We work with individuals in their 20s and we work with centenarians. And so it is a continuum. And just as someone might do ageism on someone who's 85, just because an individual might be on the spectrum doesn't mean that they can't convey their concern. Mm-hmm. Or that they have an intellectual disability. We do all those levels of advocacy.
I love it. Yeah. All right, Judah, you, and I hope I'm pronouncing your name right. You get the gold star today because you're asking some great questions. And she says, do you have a resource for companions who would be able to engage the patient in a given activity? I distinguish them from the aides who I perceive as having more limited responsibilities. But let's answer Judah's question, but also the concept of an individual that wants to age in place, that might not be ready or will ever move to a senior community, the hiring of people to come in and do a variety of things. I hear this on a regular basis that, the person that's with my dad is kind of like a babysitter and not really, so let's talk about that a little bit.
Yeah, I'll jump in here. I used to love to say this so many times. Our initial call is from an adult child or a spouse who says, oh, I can't take it anymore. And mom needs to, we've got to get her to assisted living. She has to move. And one of the things we do is slow that process down. We assess, we continuously assess. And then we do a lot of education around the arc of a typical, whether it's Parkinson's or dementia. We do a lot of education around the resources that are out there, one of which is home care. Obviously, you guys can speak to this. The industry got hit really hard by COVID. A lot of people left the industry as a result. The prices of hourly care have gone up, but we have a plethora of excellent agencies in the DMV. One of the reasons you might call one of us is to vet those. We all have relationships. We work with different agencies, different owners. We have so we know the ones that we like to go to. We know the ones we like to stay away from. We'll do everything from help you know how to screen a caregiver by providing you the questions that we ask. We will interview caregivers with the family. And in this situation specifically, the first place I would start is, can that aide that you have be a better caregiver? And I would encourage you to work with the agency to say, hey, can we tinker in the basement on the ham radio? Can we do some coloring? And work with the coordinator at the agency to make that person a better companion. If it's not a good fit, it's okay to change. But if you like the person, maybe they're just not getting the guidance. But there is a difference sometimes. All aides can be trained to be really good companions, but companion care can do the personal care. There's a distinction between a CNA and a companion. But that doesn't mean a CNA can't be a good companion. I see Karen raising her finger.
Oh, yeah.
Go.
Yeah, I think, it depends on the individual and where they are in their process and what type of companionship they're looking for. I know we certainly will create, we create at-home assisted living for individuals, and we do, engagement programs where our staff will go out for individuals with cognitive impairment, but also we utilize a variety of programs. And just like Robin's saying, the right fit is so critical. I mean, there's a million agencies out there. How do you find that right fit? And I think, again, going to a care manager who's not biased, because we aren't compensated by anyone we recommend ever, and shouldn't be, so that we can provide you really with the best fit and support for all that. But I think it's important also, sometimes people think they want a companion, when sometimes it's a matter of also knowing what's out in the community. The
Right.
biggest thing that keeps people living, what keeps us living every day, the unpredictable nature of living, and having something, having purpose. No matter where you are in your life, you need purpose. So I think sometimes having a combination of someone at home engaging and meeting that goal for you in a dignified, individualized way is terrific. But also sometimes we can say, gosh, if you thought of, this program that would give him a timeout, that would give you respite. So again, letting us know, letting us listen, and then pulling from us all those good resources to help support dignified aging in place, relocation, engagement, whatever's needed.
Yeah.
I would
Training.
say that effective care management is not looking at what people have lost, but looking at what people have. So we work on the medical side of things, but what do they still have? Could they go out and volunteer one time a week? Were they a teacher and there's a local preschool and the preschool is looking for readers, and the companion can do those kinds of things with them, but also developing that assisted living at home model. That rec therapy view of things, that music therapy view of things. So when we talk to you, our conversations will go through everything from medical and insurance to what was your profession? Tell me about your family, where you're from, and pulling all those things together. So it's comprehensive. And I love, Robin, that you use the word vetted, because a lot of times people will ask about that. We will give you, we're all very diplomatic. So we will say, here are the strengths and here are the weaknesses. And that's because we are the boots on the ground. We're in the communities. We are working with the agencies. We see when they have changes and when they are having pivots in their own, and we're able to kind of speak to that. I just saw a whole bunch of questions come across.
Yeah. I was going to say, with care management, we also globally kind of employ something called trauma-informed care, and that draws on what Heidi was saying. We need to know where the individual has been in order to be able to meet their needs going forward.
All right. Okay. Well, here's
I
one.
still encourage her to circle back to her agency and work with them to get the
if she has an agency. Yeah. But
build it into the care plan. Build into the
Yeah.
care plan.
And make sure that the individuals in the administrative component of that home care agency understands your goals and your expectations, and putting those in writing, and maybe bringing in training to be able to, help.
But again,
and encourage the aid, because I love the Montessori approach to dementia activities. Is don't necessarily always do. Can that person help you with preparing the meal, with setting the table, with getting the meal, all those things of purpose?
All right. Well, we're getting close to the top of the hour, but we got a really good question that I think may basically be a really great talking point, and hopefully we can help Cheryl here. She says, I need assistance for my disabled adult son, who is 43 years old, whose health issues has him aging as a senior in mobility and cognitive. And I myself am an aging adult with health issues, but my battle is with the state agencies on getting him care to
Mm.
keep his funding. Our biggest
Right.
battle is housing and to accommodate our disability. And Cheryl, big hug to you. I know that you feel like you're the only one going through this, but man, I tell you, there's so many families out there raising their children who are maybe now adults with the disability, and this is very challenging. But
And
I'd love to speak
any
on
words
that.
of wisdom, y'all?
Yeah.
Heidi.
This is my passion. This is one of my big passions, professionally and personally. And so as it is working from that pyramid down of what can we getting that waiver in place, getting that group home. The average wait in Virginia, I was on the board of ARC for a while, and I remember we went down to Richmond to campaign with the legislation. Was the average wait time for a waiver right now is 13 years from when you get that waiver till the end. As a parent who is aging with their own health needs and with an aging adult child with special needs, it feels like this you're like a rock above your head, and you're racing to get everything in place. So I want to know, we hear you with that, but it is not only working with the agencies, working with Service Source, working with DARS, working with all the agencies that are out there. Also, what can we get effectively in the home? So while you may not be able to get that waiver quite yet, we can work with the counties to get things in your home to make things easier. That even includes the long-term care waiver, the community-based waiver to get aids in the home if your son is declining. So there's a lot out there. We live Maryland, Northern Virginia. Maryland has some amazing things. There's a lot of programs out there. And we also help you with making sure that you have a plan when you're no longer able to care for your son. So getting that planning, a continuum for him as well.
yeah, I think one struggle that a lot of people are having with individuals such as this is also the recent cuts that have happened in terms of companion hours and how difficult it is with the reevaluations being as frequent as they are for these individuals, keeping up with the forms, knowing, sometimes people simply think they're putting the right answer and they don't realize that they've put down something that really isn't correct and they're losing companion hours. So I think sometimes it's a matter of understanding what waivers are needed. And I do recommend there's actually online, if you have a question about this, if you type in gumptioncare.com, it's actually, you'll see Medicaid waiver multi-stage search. You can put in all of your specifics, whether it is, aging, whether it is looking at someone aging on the spectrum, looking at a variety. And if you put in your state, you put in components, you put in your age, it will bring up every waiver that you can apply for. So again, it's gumptioncare.com.
Is this it?
Yep.
I believe so, yes. So, and you can put in all of that information and it will give you a listing based on your state.
Wow, I was not familiar with this. This is a great resource. So I'll drop that into chat for everybody.
Yeah, I know a lot of people have reached out to me recently, not understanding how to navigate some of the paperwork, especially for companion hours, as that has had a heavy hit post-COVID surge.
Absolutely. One thing we didn't touch on, Steve, is being here in Northern Virginia, Veterans Affairs, and understanding all that is available for veterans. And the reason why I thought of it is when you have an aging special needs child, there is some things that can come to your child through the Veterans Affairs, even as you're retiring, even long before you get to a later stage. So, walking it through, and again, we can work with you, and then we can take a step back, and then you bring us back in. It's really person-centered. It could be as robust as you need us to be, and then we can be, a resource that you have to cue in again and again.
In your back pocket. We tell people,
I like that, in your back pocket.
Where once you've met with us and had a consultation, we're in your back pocket.
That's right.
Down the road, a 5-minute phone call, a 10-minute phone call. Yeah.
One thing also to pair on to aid in attendance is the struggle that many people have in paying for care. and understanding that Medicare does not cover long-term convalescent care needs. I get calls, we probably get 10 to 20 calls a week, people saying, but it says it'll cover skilled nursing home care. And understanding that Medicare does not cover that. It's for small continuum of care for a specific reason under certain circumstances. So, if you have an issue, in terms of having stress over thinking, how am I going to pay for care? Please do not wait. That's the one thing I think all of us, Heidi, Robin, and I want to be able to tell you today is be proactive. Even if you have financial constraints, start planning with one of us now, because we can navigate through aid and attendance or through an auxiliary grant or whatever to find a way to make your situation work. Because once you wait until something catastrophic happens, it becomes all so much more complex and stressful for those, participating.
Man,
Starting early is the most successful thing, because we can start working toward when you need those, like an auxiliary grant, when you're ready, when you need it. We've already been working towards that, and then we're able to do it.
When's the timing?
yeah.
That
this is
timing
great.
is huge.
Or also some people don't realize that there's just multiple paths. Is the path going to be, a Medicaid skilled nursing? Is the path going to be a residential care home that's reasonable? Is the path going to be an auxiliary grant if you have very low income and qualify and a bed becomes available?
So
So
I love this, and I see we've gone through an hour, but if you guys can hang on just real quick. Rita asks, define a waiver, and Rita, thank you for asking a question like that, because we're in this field and we're talking to so many people that sometimes it's just sort of like, this, that, and the other. But would one of you like to give an example of where a waiver kind of comes into play and what it is?
So I would say it is your payment. What is your payment source, right? So a waiver is for housing, for the housing to pay for where you're going to live, or a waiver can be used to pay for a limited amount of time each day in your home. So there are different types of waivers out there, and we've mentioned a few. There are dozens. There's a lot of waivers and scholarships out there, and so a waiver is payer source, I would say, would be a good example.
And it can
Add
be
to that, it typically means lower or moderate income or veterans. It's not connected at all to Medicare, which to distinguish that. It is not available. Waivers are not available to everybody, and it mean right. I don't.
Yeah,
no, you need qualifiers.
Rita, one of the things is all waivers require an application process, and oftentimes we go on this journey on our own and we fill it out the right way. We read the instructions for hours, we fill it out, and then, it gets denied or something like that. And sometimes this is an area where just having a team member, somebody that, hey, look at my application before I send it in, or one of an aging life care manager saying, make sure you don't put this in there.
Yeah. The biggest piece, I will say, again, waivers are community and home-based for support for services and funding, obviously. And this can be children, adults across the continuum, depending upon whether you're applying for long-term care, disability services, whatever. But the important piece is always get someone who is an eligible party to review your applications. One error will set you all the way to the beginning. And honestly, the financial consequences, I cannot stress this enough, are catastrophic. And I talk to families all the time, and they're like, well, I don't really want to pay for someone to help me with this process. It is money well spent.
Yeah.
Because it's easy to make a mistake.
This has been great, y'all. And I could honestly chat with you for days. But actually here, that's not the page that I wanted to share. I want to do this as we kind of close our session this month and get ready for the conference next month. But this is the Aging Life Care Association website. And if you click on the orange button at the top, you can scroll down and you'll see you can, I don't even know what this zip code is, but let's say 48400. No matter where you are in the country, you can load up. Okay, I guess that's not here. 21255. Maybe that's a real zip code. I didn't want to use, well, I guess I'm going to have to use my zip code. But I wanted to kind of get out of the mid-Atlantic area just in case we have somebody in Des Moines, Iowa. Well, here. Okay. Trust me, folks, this is a great search tool. There are aging life care managers all over the country, and connect with a few, talk to a few, and then don't worry, on the recording link that I'm going to put at proaging.com today, I'm going to have these three their contact information so you could reach out to them. And even if your loved one's in St. Louis, you can give Robin, Karen, or Heidi, reach out
You
to
bet.
them. They
You
might
too.
know of a colleague there that they would say, here, give this one a call first.
And we do multi-state and any
Yeah, we do. Yeah.
we have
And I
people
think,
all over the
thank
world.
you for putting up ALCA, because ALCA, people on ALCA means that we have gone through the preceptorship. We've done all of our hours. We've taken our board certification, and we do our continuing education. So we're standardized.
And in closing, on the topic of waivers, I love the comment that Marcel puts in there, and this is the community aspect of these discussions. He shares that, Medicaid waiver can take up to 2 months or more in Northern Virginia. And, but getting that done right, folks, there's waiting lists for all these things. One of the ways that they don't pay us is that, as Karen had said, that one thing that you didn't fill out right. Oh,
That's right.
sorry, you backed to the line. So it's getting some expert help to give yourself the best chance that you can get these entitlements. And again,
Yep.
that's like worth its weight in gold, to hire an aging life care manager, because it could mean thousands of support through a waiver program or what have you.
Yeah.
All right. Thank you so much, y'all. And this has been a great discussion. And I really look forward to seeing all of you at the conference next month.
Yeah. Thanks for supporting
Thanks.
it. Thanks, Heidi, Karen.
All right.
Thanks,
Yeah, it was